Hello, 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 YouTube world. It is Thursday at 3, time for our live weekly question and answer session. And I'm your host, Miss Patty with 4 Year CNA, but you guys already know that. Thanks for joining me today. I hope you guys had a fantastic Valentine's Day. I know I did. And it's one of my favorite holidays because it has everything to do with the heart, which is what I'm all about. All right. So while let me just pull everything up here. I'm going to pull up the chat so I can see what you guys are asking. So give me just a second here. I can't see past my microphone. All right. So as always, I usually give a little bit of a lesson. Make sure you pop in and say hi when you're here so I can recognize you. I usually give a little bit of a lesson while I'm waiting for you guys to filter in. So today, I actually want to talk about something that's been coming up over and over in our weekly sessions. This is a question that a lot of you have, and I want to take some time to talk about it. And that is, what is a caregiver, a home health aide, a CNA? We've talked about the difference between CNA and PCT before, but there's a lot of ambiguity out there about what the difference is between a CNA and a home health aide, and what a caregiver is, and where does everybody fit into the big picture. So it's kind of what I want to talk to you guys about today. And in order to understand that, we have to spend some time defining what personal care skills are. So because that really has a lot to do with the definition. Okay. So, personal care are things that you do for yourself every day, independently. And if you weren't able to do those things and needed some help, personal care is what somebody would do to help you with tasks you would normally do for yourselves. So, let's think about this, right? When you get up out of bed, the first place you usually go is the bathroom. So most people go to the bathroom as soon as they get up. So you go to the bathroom. So toileting is a personal care skill. Grooming. So you might wash your face, brush your hair, wash your hands, something like that. That is a personal care skill. It's something you do for yourself all the time, right? Dressing, bathing, grooming, eating. These are all personal care tasks that you can do for yourselves. But even things like mobility and keeping your environment clean, those are things that you would normally do for yourself as long as you're able to. These are not nursing tasks. So it's really important to understand that. What I'm talking about, personal care skills, are not nursing tasks. They're personal care. So anything that you could normally do for yourself, because you didn't have to go learn how to toilet. I mean, you were taught as a child, right? You were taught to how you were potty trained. You didn't have to go to school to learn how to brush teeth, right? That's a personal care task. So personal care, let me pull up. Hold on, guys. I lost your chat. Where's your chat? Um, where is it? Hold on. I'm sorry. There you are. Okay. So personal care skills are skills that we would normally do for ourselves. And it's different from nursing. Nursing skills are something completely different in a whole different category. So think of personal care as things that your friendly neighbor could do. So let's say that you broke your leg and you needed some help opening a can of soup and heating it up on the stove. And you called up your neighbor and said, "Hey, I got a broken leg. I can't stand. Can you come help me open this can of soup, heat it up on the stove for me so I can eat?" And your neighbor, if they're a good neighbor, probably came over and said, "Sure. What else do you need while I'm here? Do you need help, wrapping your leg up so you can get into the shower? What do you need help with?" These are personal care tasks, or think of it like friendly neighbor tasks. These are things that pretty much anybody can do, right, on themselves or help others with. Personal care. This is different than nursing skills. So nursing skills are things that you have to be trained to do that you don't already know. So friendly neighborhood stuff, cooking, cleaning, bathing, grooming, dressing, that kind of thing. A little bit different. So nursing skills would be things like vital signs, right? You're friendly. You can't call up your neighbor and say, hey, I broke my leg. Can you come over and take my blood pressure? Right? Because most people don't know how to take a blood pressure. That's something that you would have to be trained to do. Things like caring for a catheter. You can't call up your neighbor and say, hey, I got this catheter. Can you come over here and come take care of it? Your neighbor doesn't know how to do those things. So nursing tasks require a higher level of knowledge or training. So you guys get the difference between personal care, things a friendly neighbor can do, things you do for yourself every day, and nursing tasks that you need additional training for. But this is where it gets tricky. Okay, that part most people can get. That's the easy part. This is where it gets tricky. Okay. So anybody that's been in my class or been around me for a significant amount of time understands the care plan process, because I eat, breathe, and sleep the care plan. And say it along with me, guys. It's the care plan, the whole care plan, and nothing but the care plan. If you've been with me for any amount of time, you know that. So I want to review how the care plan is set up, how it works, right? So every single shift, every patient has to have an assessment by an RN. So if you're under nursing care, a nurse has to assess you every shift. So if you're in the hospital, a nurse is assessing you every shift. If you're in a nursing home, a nurse is assessing you every shift. If you're in a rehab center, a nurse is assessing you every shift. Now, that nurse's job is to look to see if there's any real problems or potential problems that may need to be addressed, that either the patient changed or they're a new admission, or we're always looking for real problems and potential problems that we can solve. So think of a nurse like Sherlock Holmes. They're doing an assessment to find problems. Now, when they find a problem, then they have to find a solution, right? We can't just say, yep, found a problem. Okay, good luck. Bye. Right? We have to find a solution. And if I'm assessing a patient, I find a problem, I discover a solution, and I tell my CNA, this is what I want you to do. That's between me and the CNA. But what's going to happen when we both go off shift, right? So I've got to have a way of passing this information on to the next shift and the one after that. So everybody's always on the same page, so that I'm not implementing something and saying, okay, this patient really needs to be out of bed and in a chair at least twice a shift for mobility to prevent constipation. And, I've done all my assessment. This is my recommendation. And then the next nurse comes along and says, oh, no, leave him in bed. Right. So we want everybody to be, in order to get results, we want everybody to be on the same page. So when I do an assessment, I write down my plan so that it goes on to the next shift. Now, the next shift can change it, right? So if that nurse comes on and says, oh, no, we don't want this patient out of bed. They just fell, or they developed a blood clot or something like that. The care plan is not set in concrete. It's not even set in like sand. The care plan can be changed by any nurse based on the circumstances that are happening at that time. So nurse does an assessment, finds real and potential problems, discovers a solution, writes it down, and that is the care plan. But the biggest nursing task there, if you noticed, right? I start IVs, I give medications, I take care of wounds, I do dressing changes. But my biggest task, the biggest reason for me to be at the bedside, is to assess the patient. Assessment is the foundation nursing task. Way more important than anything else we do. Okay. Everything else is a doing. Assessment is why we do. So assessment is the most important nursing task there is. I hope you guys are getting that. Assessment is the most important nursing task there is. So let's go back and what we were talking about, right? So personal care, things you do for yourself every day, friendly neighbor stuff. CNA or nursing tasks are things that we help the nurses with. But remember, the most important nursing task is assessment. Now, CNAs cannot assess. We're not allowed to do that. But what the majority of the CNA training is teaching you things to look for so that you can tell the RN, hey, I noticed this. So my patient has been perfectly okay, but today they're very confused. What's going on with them? You let the nurse know so they can do another assessment. Or the patient hasn't been eating well in the last couple of days. You let the nurse know. Or when I'm emptying the drainage bag, the urine smells really funky. Let the nurse know. So the biggest task that a CNA has is observation and reporting. So the biggest task a nurse has is assessment. The biggest task the CNA has is observation and reporting. Now you're going to do all those personal care tasks as the patient needs them done, and that gives you an opportunity to observe and report, right? So it gives us a reason to be at the bedside. We're going to help the patient with eating and bathing and grooming and all of those things. But those aren't nursing, those are personal care tasks. So do you guys understand there's two different categories here? Two different categories here, right? So personal care, friendly neighbor stuff, and nursing tasks, which includes observation and reporting. That's the most important task a CNA has. Okay. So when we go to those terms, right? So home health aide. Home health aide is a paid friendly neighbor. That is what home health aides do. They are going to help patients with all those personal care tasks: bathing, dressing, grooming, maintaining a clean environment, companionship, socialization, eating. Those are perfectly okay for a friendly neighbor to do, and a paid friendly neighbor, which is a home health aide. Now, we want our home health aides to know a little bit about infection control, especially if they're going home to home, because we don't want to pass things along. We want our home health aides to know a little bit about, um, you know, things relevant to that patient, right? But for the most part, they're just friendly neighbors, lending a helping hand. Now, CNAs can do all those things too. You can do personal care tasks, but you also are trained in observation and reporting. So that's the big difference legally between a home health aide and a CNA. A CNA has additional training to teach them what is normal and what is abnormal so that they know how to report to the nurse what they're seeing, hearing, smelling, feeling, that type of thing. So home health aides do routine, repetitive tasks that the patient would do on their own if they were able to. That's actually the legal definition, right? CNAs do those things and observe and report to assist the nurses more effectively. Okay. So home health aides, routine, repetitive tasks. So home health aides are not working with patients that change rapidly. This is routine, repetitive. Martha's the same yesterday, today, and tomorrow. We're just there to help her cook, clean, dress, bathe, that type of thing. Personal care. Now, when Martha starts getting a little bit older or develops a condition and is no longer stable, now that home health aide is no longer appropriate. Now we need to step up to a CNA that has those observation and reporting skills. Do you guys see how this works? Okay, so home health aide, routine, repetitive, friendly neighbor stuff in the patient's home. That's where home health aides work, in wherever the patient lives. CNAs, because you're certified, you've taken a test. CNAs have been trained in observation and reporting, and they can work in a lot of other places. Yes, they can work in the home care. Sure. They can work in assisted living. Absolutely. But they can also work in hospitals, nursing homes, basically anywhere a nurse that works. So that's really the difference. Now, caregiver is this is kind of a new term on the block. Caregiver is even more removed than a friendly neighbor. So a caregiver is that neighbor that you just kind of wave to. You right, but one you don't really want helping you with toileting. Like I've got a neighbor that lives next door. I like her; she's nice, but I don't think I'm comfortable enough with her that if I needed help toileting, I would call her up and say, "Hey, can you help me out here?" Now, my best friend, she would be on speed dial. Hey, come help me out. So, there's levels of, so caregiver is kind of that person that would help with taking you to the doctor's office or going grocery shopping or playing cards, kind of recreational activities, that type of thing, but wouldn't really be helping you with like a lot of personal tasks. So not a lot of hands-on care. So caregiver, a little bit removed. Home health aide, friendly neighbor that's helping you with bathing, dressing, grooming, toileting, personal care stuff. CNA, all of those things, and observation and reporting. So good. I hope that helps you guys. I hope that helps you. So let's see who's here. Denise, good afternoon. Oh, you've been waiting patiently. Thank you, Denise. That is awesome. Carol, hi. I am perfect today. How are you? Tia, hello. Jennifer. Hey, Jennifer. Thanks for joining us today. Jacket says hi. So what is the difference between assisted living and nursing home as far as care? Okay, Jennifer, I'll get to that in just 1 second. It has everything to do with what we're talking about. Kimberly, hello. Rachel, hello. Hi, Miss Patty. My test is tomorrow. I'm so nervous. Oh, so exciting. Good vibes to you. I'm sending out tons of good vibes. Good vibes. You're going to do fine. Raina says hi. Gloria says hello, Nurse Patty. Good to see you. Good to see you, Gloria. John says watching from Seattle. Hi, John. Blue Jedi says hi, John, about 100 miles south of you. Neighbors. Tia said, watching from Dallas, Georgia. Oh, wow. I had no idea there was a Dallas, Georgia. Let's see here. Jennifer says they do blood pressure and assisted living, correct? And CNAs aren't required. They're just caregivers. Okay, we'll talk about that right in just a second, Jennifer. I know this is a very complex subject, okay? So it may take me a little bit to get everything covered. Kimberly says, I'm a home care worker. I use the skills I learned from your videos to improve my skills in my care with my client. Oh, that's awesome, Kimberly. I'm so glad we were able to be part of your journey. That is wonderful. Thanks for including us. And thanks for stopping by and telling me. Monique says, good afternoon. Blue says, I love how you break things down here in Washington State. What a home health aide does is a weird blend of CNA stuff and what you're talking about. Tia says, my 6-year-old son, Weston, is watching with me. He said, hi, Nurse Patty. Oh, Weston, hi. Thanks for joining. We love to have new joiners. And hopefully you grow up and want to be in healthcare because we really need good healthcare workers. So keep that in mind. Look at when you grow up, look in your high school for a health science class because I'm probably affiliated with them. Let's see here. Tripty says hi, and Emanuela says hi, Miss Patty. Okay, so let's go. Oh, Monique, very good. Congratulations. Monique says, good afternoon, Miss Patty. I passed the test. Thank you very much for your support. Congratulations, Monique. That is awesome. We're super proud of you. So let's go back to what Jennifer says. Okay. So we now understand the difference, right? Caregiver, neighbor, you don't really know too well, but it's going to help you with socialization and transportation. Home health aide, neighbor, you know a little bit better, helping you with some personal care stuff. But routine, repetitive, every day's the same day type of thing. Patients are stable in their homes. CNA can also do all of those things, right? But CNAs are going to add in observation and reporting skills. And because they're state tested, they can work in a wide variety of places. Okay. Now, to further complicate the issue. Okay. So you guys have that down pretty well. If you've got that down pretty well, put yes in the, or Y in the chat. Let me know. Do you have that down pretty well? I know there's a delay, guys. I'll just stand here and look at you. So do you have that down? Okay. Tia says, now my other two are watching, Jensen and Knox. Awesome. Oh man, Tia, you have got your hands full. I had 3 all close together. I know. So thanks guys for watching. Okay. So here's the thing. Okay. Now, all of that, if you have that foundation, caregiver is kind of a hands-off type thing. Home health aide is hands-on, but routine tasks, CNA is all of that, plus observation and reporting. Now, where this gets complex is that as a nurse, as an RN, I can train anyone to do additional skills as needed by my patient. Okay. So if I am working in home care and I've got a wife who needs to learn how to do a dressing change on her husband, I can teach her that because I am an RN and I can teach people how to do skills. But there's a big caveat to that. Okay. If you are un if you are just a normal person, okay, and I go into your house and I teach you how, let's use that example. Let's say a male patient has a huge wound on his leg, and they don't have home health services, so the wife is going to have to learn how to change those dressings. So I go in there and I teach her how. I do another visit and I watch her do it, and I'm pretty comfortable that she can handle this. I tell her what to look for, give her a list of things, give her the doctor's phone number. Hey, if you see any of this, call him. Okay. So they know exactly what to do if there's a problem. I'm allowed to do that. And I can also do that with home health aides. So if you are working in a home as a home health aide, you can be trained to do additional tasks by the RN, but it can only be done on that patient. So let's go back to the husband-wife team for a second, right? So I taught her how to do dressing changes on his leg, only his, told her what to look for, who to report to, so she's got all the information. But that doesn't mean that she can go down the street and take care of everybody's wound, right? Because every wound is different. I did not give her the authority to do this anywhere else but in her home on her husband. Now, if I train the home health aide, I am training that home health aide on that one individual. So whatever I need that home health aide to do, as long as I provide training and I make sure the home health aide is competent to do it, then I can train that person to do additional skills on that person, not in the community, not with the next patient, not on that person only. So this is what's called directed training. So I can do that with a home health aide or a caregiver. I can also do that with a CNA. Now, CNAs can also be trained. So caregivers, home health aides training has to be done by an RN on the patient, and that training only applies to that patient, period. End of story. CNAs, that also applies to, but CNAs can also be trained to do additional routine tasks that aren't patient specific. So I can train a CNA to remove catheters from a patient, if we're working in a setting where that is a task, a repetitive task that needs to be done. But I'm going to have to do it a little bit differently. And there's a lot of criteria that has to meet. It's not as simple as me coming up to you and saying, hey, you want to learn how to take catheters out? Come with me. It's not quite that simple. There's a lot of legal stuff on the back end that I have to address. Okay, so there's some delegation rules. There's actually 5 delegation rules. So I'm not really going to go into that too much, but remember that at its bare minimum here, caregivers are kind of friendly neighbors that can take you for transportation, recreation, doctor's offices, that type of thing. No hands-on care. Home health aides are friendly neighbors that provide hands-on care, but only repetitive routine tasks that the patient would do for themselves if they could. And then CNAs do all of that, plus observation and reporting. Now, nurses can train those caregivers and home health aides in patient-specific things, and nurses can train CNAs in patient-specific things and routine additional tasks. Okay, so do you see that those CNAs, they're able to be used in a little bit different format, a little bit, we have a lot more flexibility with them. We can train them in some other additional things. So that's what the difference is. Now, Jennifer asked that sometimes in assisted living facilities, the caregivers there, or resident aides, they're often called, do blood pressures. This is very similar to, remember I said that as an RN, I can train you to do, something on that patient. So if I've got a patient who needs his blood pressure checked every day, I can teach the wife how to use an automated blood pressure cuff. Press this button, put the cuff on here, make sure this cord is hanging here, press this button on the machine, write down these numbers. And I can do that training, right? So in assisted living, a lot of times they will have the resident aides do blood pressures like that as well. But resident aides in assisted living, generally speaking, are not taking manual blood pressures. That's not really in their scope of practice unless there is a limited nursing service license attached to that assisted living. That gets that's another very, very big gray area. And I don't really have time to get into all of that right now. But there's different levels of ALFs. But generally speaking, when you're talking about blood pressures and an ALF, it's an automated machine, and the patient would do that themselves if they could. And a lot of times they do. We just bring them the machine, put the thing on, and they hit the button. So that's perfectly okay. We're not interpreting them. We're not making medication decisions based on those readings. We're just like a wife would at home, taking her husband's blood pressure. She gets the blood pressure, she writes it down, and the doctor figures out what to do with it from there. Okay, so I hope that helps you guys kind of understand this. So hold on, I got to get some water. I'm talking a lot today. Wow. Hold on. Okay, so Emanuela says, I passed my written test. Thank you. I knew how to answer the questions courtesy of your video. That's awesome. The particular one where you explain not thinking too much or adding what's not in the question. Yeah, that's a big problem for the test. The test stands alone. Good job. Thank you, Emanuela. Congratulations. We are super excited for you. Kimberly says, I'm a caregiver, but do a lot of personal for my client who needs all personal done for her. Well, then, Kimberly, you probably should, you really should be classified as a home health aide. And generally, home health aides get paid a little bit more than caregivers. I would talk to your supervisor about that. Keisha says, hi, Nurse Patty. I have New York State exam tomorrow in Florida. You have my state exam tomorrow in Florida. I'm so nervous. Oh, Keisha, that's so exciting. I know it's nerve wracking. You probably won't get a wink of sleep tonight, but I'm sure you'll do fine. Just if you haven't yet, go back and watch some of my videos, especially the one where I talk about the written test. We do a deep dive. It's probably about 5 weeks ago. 4 or 5 weeks ago, where we do a deep dive into the test. Go watch that one, the written test, and that will help. As far as the skills test, remember, it's always about the patient. Always about the patient. Don't make it about you. Make it about the patient. And I'm sure you'll do fine. Make sure you come back and let us know in one of the comments on one of my videos so we can congratulate you when you pass. Emanuela says, but looking for a job, they keep asking for license. What do I do? Oh, okay. So Emanuela, I'm assuming you're in Florida. I don't know. I'm not real sure what state you're in, but in a lot of states are like Florida. You have to have at least 75 hours of training to be a home health aide. And that's just on infection control, not abusing the patient, financial concerns when you're in somebody's home, those types of things. You probably want to find a home health program and go through it. I don't have one anymore. I don't really know where to refer you to. But certainly getting a home health aide, but there's a workaround, right? So I'm talking about Florida right now. Other states have different laws, but Florida has a very specific loophole that you might be able to benefit from. If you go to an actual home health company, okay, not a nurse registry, you need a Medicare or Medicaid certified home health company. And if you go to that company and tell them you want to be a home health aide, they can give you a test right there at their place. And if you pass the test, they can work you as a home health aide for their company. Now, it doesn't transfer anywhere. It's not like, when you go to school and you get your own certificate, your own home health aide certificate that you hold, that will allow you to work for any home health company. But if you don't have one of those and you don't have a school near you, you can go to work for a Medicare or Medicaid certified home health company. Tell them you want to be a home health aide, take the test. It's a state test that's given right there. It's a written test. And then they can allow you to work under their company as a home health aide. So it gets you that little bit higher rate of pay. And it's a workaround. So that's what I would recommend for you, Emanuela. I think that would be a very good option for you. Blue says, Miss Patty, true in Washington State with medication, if the care plan says caregivers Bob, Mary, Tom can give client June an insulin shot as needed, and Gary comes in, Gary cannot. That is correct. Absolutely. Because the training is patient specific, caregiver specific and patient specific. That is correct. Or the client's doctor has to tell agency case manager okay, so basically what you're saying there is that we have to have verifiable documentation that person has been trained. So absolutely true. Jennifer, that's good. Did you go to RN school before or after you had your kids? Okay, so I'm an open book. There are no secrets here. So I went to LPN school when I was young, before when I was still a teenager. Okay, I graduated from LPN school at 19, and I got pregnant with my first child in LPN school. It was tough, but I graduated, and I worked as an LPN for 10 years, and I had kids in that 10 years. And then after I was an LPN for 10 years, I went back to school to get my RN. So yes, I went back to school for my RN when I had children at home. And yes, it is hard. Absolutely. I still have nightmares, but it is the best thing I ever did. And I would recommend it hands down. It is a lot of work, but anything worth something is going to take a sacrifice. Okay. Remember that nothing good comes easy. Okay. So you're not being nosy. It's fine. Let's see here. Kanisha says, I have a question. I wanted to ask you, if I pay for my state exam, how long does it take them to let me know when I'm supposed to take my exam? Okay, Kanisha, great question. So right now in Florida, so I'm just talking about Florida. I don't know numbers in any other state, guys. I'm sorry, I can't really help you there. If you're in other states and you know this information, get it to me so I can pass it on to other people. But in Florida right now, when you apply for the state exam, as long as you have a level 2 background check on file and no criminal history that needs to be cleared. So assuming you have already done your level 2 background check with a photo and you don't have a criminal history, when you register for the state exam, about roughly 7 to 10 days after you do that registration, you'll get your test date. It's pretty quick in Florida. You'll be testing about a week after that. So from the time that you register until you're testing is usually somewhere in a 3-week time frame. So it's actually pretty quick. Blue says, wow, Patty, being an HCA in Florida is nowhere near as complicated as it is here in Washington. Yeah, every state is different and has different laws. Emanuela says, I'm in the UAE. Oh, okay, Emanuela. In that case, I don't really know. I would look around for a home health aide course in the UAE. I'm not really familiar with, I can't even get all the laws of our 50 states together, and I'm not even about to try to tackle international. I would be completely gray. It's a very complex topic. Kimberly says, the good thing is the company I work for, we all got a nice pay raise. Nice. That is always welcome. Very good. They're trying to keep you because everybody's scattering right now. Sama says, I just passed my test on February 8th. Thanks to your video, I didn't have a single mistake. That is oh my gosh, it's incredible. I'm so proud of you. Congratulations. Great job. Thanks for letting us be part of your journey. We're super excited to hear that. I also have my license for phlebotomy, so now I'm a PCT. Yay! Very good. The hospitals need you. Go apply. Go, go, go. NZ says, where can I get some questions for Prometric written? Go onto my website, foryourcna.com. The number 4, YOURCNA.com. This right here, foryourcna.com. Up under training, you'll see the practice test. Go take it. It's 60 questions, multiple choice, just like the practice test for Prometric. It's not the same questions. I got to make this clear because people keep yelling at me. The questions on the test I can't give you the test questions, guys. That's unethical. I cannot give you exactly what's on the test. It's a test, right? But it gives you the same types of questions, the same types of comment or content, the same way the questions are going to be phrased. It's very similar in scope to the state written exam, but it's not the written test questions. Keep that in mind. It is a test, right? Let's see here. I just noticed my CNA license expired a year ago. Is it possible to take an exam? All right, Kathy. So I don't know where you are, but in most states, if your CNA certification expired, you have to go through the whole process again. So that means that you have to retest to be able to get it back. Now, if it's been expired too long, you may have to go through another program. I urge you to contact your board of nursing to find out, or your CNA registry. My website has a whole list of them. So go to my website. Under after certification, I have a list, but contact your CNA state registry to find out what's necessary. NZ has your New York State exam next week. How exciting. Make sure you come back and let us know on one of my videos. Just drop me a line, tell me that you passed so we can congratulate you next week as well. Blue says, how did you end up in teaching? Or is that a long story for another day? You got that right, Blue. I'll explain that very briefly. I've got about 2 minutes. So let me give you the short version, guys. Okay. Short version. So I was working for the school board, working with the ESE kids or special education kids. And I was also doing their CPR for them as well for the school district. And I had a small retail store where I sold scrubs, medical uniforms. And I started teaching CPR in the scrub store at night. So I'd move guys, this was crazy. I'd move all the racks out of the way, set up tables and chairs and dummies. I'd teach CPR. And at the end of the night, I'd break everything down, break all the tables down, store them behind the scrubs on the wall. It was crazy. It was so much work. And some of the nursing home administrators in my area said, we really need good CNAs. I really like the way you train. Can you consider putting a CNA class together? And I said, sure, it can't be too hard. I'll put a CNA class together. And that started my 15-year journey into CNA training because it wasn't nearly as easy as I thought it was. Here I am an RN, and I thought I knew everything there was to know about CNAs, and I didn't even know the basics. And that really led me on this journey. So that's how I started gathering information and doing these deep dives into the state statutes and the rules and the Florida Administrative Code and the difference between the Board of Nursing and AHCA and who regulates what and the testing process and becoming a Prometric testing expert. And I did all of that simply because I wanted to give my students in the classroom the best possible education and make sure I was training them in the right way, not just to be able to pass a test, right? Because for me, it's not about the test. It's never been about the test. It's about the day after the test when you go to work and you're working on an actual live patient that needs you. If you don't know what you're doing, that's the person that's going to suffer. And there was such a disconnect between, and I know you've heard it. People saying, well, this is the way we do it for the test. And then this is the way we do it in real life. And students are like, well, that doesn't help me Because yeah, I'll be able to pass the test, but then when I get over here in real life, you're not there to tell me what to do. So what do I do? And it causes a lot of confusion. And I figured there had to be a better way of doing this. And that's how I developed my program. And if you listen to my program, it's all about the care plan. That's the one constant that we start on day one of the program, all through the program, all through the test, and then into the clinical setting. So on that first day of work, when you're a CNA and you are working with a real person, it wouldn't dawn on you to go, oh my gosh, what do I do now? You know that the first thing you have to do is go to that care plan. What does the care plan say for this patient? And you know that this patient is different from the one over there, and that one down there is going to need totally different care. You understand that because of the training. So that's how I got into education, Blue. It's a much longer story than that. That's kind of the condensed version, but I did it because I'm trying to keep those future patients safe, but I'm also trying to give you the tools that you need to be successful, not just in the classroom or on the test, but when you transition into that education or into out of education into that clinical setting. You don't have that whole, oh my gosh, I went to school for nothing, I learned nothing, and now I'm like, what do I do? That doesn't help anybody. Nobody in this scenario benefits. And that's what I'm trying to work against. Okay. That's why I teach in a very specific way, so that when my students get out there, they're ready to go. They're just like, oh, okay, I know what to do now. And it just makes that transition way easier. Hope that helps. Let's see here. Kanisha says, I'm in Florida, already had a level 2 background and work in a nursing home. Very good. Very good. Sama says, best of luck for everybody. Kathy says, I'm an LPN student right now. Would love to teach CNA. Do you think it's possible as an LPN? Yes, some places do allow LPNs to teach CNA. It depends on what state you're in. Okay. Selena says, I was order a book, but they sent a CD. What can I do for the book, please? Selena, send us an email for your CNA at gmail.com. Send us an email and we'll check into that. Okay. Send me an email on that. All right, guys, comes to the important part of today's lesson. We get to congratulate those that passed. We're so excited. So these are the people that dropped by my channel this week. Let me know that they passed the state exam. If you're getting ready to take the test, make sure you drop by and let us know so we can congratulate you on an upcoming lesson as well. So here we go. This week, we are congratulating Hoa Do for passing the state exam. Great job. And Aminata Camera passed the state exam. I'm sorry if I butchered that. I'm so sorry. There's a lot of A's in there. That is an awesome name. So congratulations on passing the state exam. We're super proud of you. FSIU also passed the state exam. So great job. Bujiina passed the skills. Drop by to let us know. Sama, you came by in person, so congratulations. And Tammy Cherie passed the state exam this week, and we're super, super happy for all of you. Welcome to healthcare. Testing soon on Monday. We have Kenny Poo's Life and Sylvia Strozier testing on Monday, so good luck. And Chi Chi OG is testing in March. We're going to send out good vibes to all of you. I'm sure you're going to do fantastic, along with the ones that we talked about earlier today that dropped by to tell us that they're testing soon. We are super happy for all of you and wish you tons of luck. And we know you're going to do fantastic. So let's see here. Denise says, Miss Patty, so amazing. This is really your calling. You're so proficient with it. Well, thank you, Denise. I am very fortunate. I will tell you that I am one of the few people in the world that gets to do what I love to do every day. So this is not a job for me. This is my heart. And I'm super, super excited to be able to hang out with you guys every week. And thank you guys for spending time with me. This would be awfully lonely if I was just sitting in here talking to myself. So I thank you guys for showing up every week and being here just to hang out with me. I love it. This is my special time every week. So keep coming. Let's see here. And Stella, your board exam is on March 3rd. So good luck. Let us know how you do. Gilo says, I'm going to start my CNA class next month. Congratulations. Great job. Mumina says, hello, everyone. And Denise says, congratulations to all who passed. Flo, I passed my exam last week. Oh, congratulations, Flo. Awesome. And Fred is testing next month. Wow. Great job, guys. I'm super excited for all of you. I hate to do it, guys, but I have to wrap up this week, and I'll be here next week, Thursday at 3, to answer all of your questions. And next week, let me give you let me tell you what we're going to talk about next week. Next week we are talking about the bucket of nice. So we're going to talk about the bucket of nice next week. So make sure you tune in, because that's one of my favorite things to talk about. So make sure you tune in next week, next Thursday at 3. Hope to see you guys there. Until next time, happy caregiving.